Let's talk a little bit about diagnosis because it's not easy to diagnose it. And we have a clinic called the Child and Adolescent Mood Disorders Program, or CHAMP as we abbreviate it at UCLA. We have a lot of kids that come in with what looks like bipolar disorder, or maybe somebody said it was, and we do a full interview using an instrument called the Kitty Schedule for Affective Disorders and Schizophrenia. It's also called the Kitty SADS. It's a diagnostic interview, a little bit like the SKID or one of those other interviews, where we interview the kid, we interview the parents, we interview both together, get any discrepancies, and come up with both diagnosis and any comorbidities. We believe that in terms of lifetime in both adults and children, the rate of bipolar 1 is usually around 1.2%. The rate of bipolar 2 is about 0.6%, with hypomania alternating with major depression. So again, about 2% of the population. Some people would say 4%. I think that's too high. So about 1 in 50 people. I mentioned the fact that depression occurs more often than mania, and hypomania I defined as 4 days that don't cause major impairment, even though the states are noticeable to others. So we have to kind of distinguish when we're dealing with bipolar 1 or 2. And it's easy when someone presents with just a full manic episode, then we know that they have bipolar 1. It's a little trickier when we see a depression. Then we have to really do a lot of digging and deciding whether or not what we've heard are true hypomanic episodes in the background, because it's very unusual for people to consult a psychologist or psychiatrist when they're in a hypomanic episode. It feels too good. Now, I think somebody asked about cyclothymia, and also let me talk about the other specified bipolar disorder diagnoses. These are kind of the hedge categories in the DSM, the folks who have manic and depressive symptoms but don't quite meet the full criteria. So, for example, cyclothymic disorder, people are going back and forth between hypomania and dysthymia, periods that might only last a few days, but frequently they're going back and forth between these extremes. A couple of day period of mania, a couple day period, or hypomania, a couple day period of depression. Now, in other specified bipolar disorder, we're talking about manic or hypomanic episodes that are recurrent but of insufficient duration for the full mania or hypomania DSM criteria. So this happens a lot with kids, that they have these manic or hypomanic episodes and they are recurrent, but they only last a couple of days. So they might have multiple 2-day periods in which they're elated or irritable, but they don't have all of the B symptoms like decreased need for sleep, racing thoughts, grandiosity, distractibility, and so forth. Another presentation might be major depressive episodes with some subthreshold manic symptoms. The key feature of these subthreshold conditions is what we call mood instability. And that's a feature I'd like you to take home, is this idea of mood instability. Kids who very suddenly change from one emotional state to another, from normal to elated or irritable or crying, or suddenly enraged, or suddenly very anxious. There's a sort of sense of they've got these different flavors, and these different moods can come on from very little triggering, and in sort of a constant, I never know what kind of mood my kid is going to be in. That's a feature not only of bipolar disorder, but of many psychiatric disorders. It features in ADHD. It particularly features in bipolar disorder, also shows up in borderline personality. But the reason that's important is because it's predictive. In kids who have mood instability or one of these conditions like otherwise specified bipolar disorder, they have a greater chance of converting to full bipolar disorder, especially when they have a family history of bipolar disorder. So if I wanted to find a group of kids who are at risk for having bipolar disorder, I'd look for kids with mood instability, ones who have these very short periods of elation and irritability, and with some depression, and those who have family histories of bipolar disorder, and usually a parent, although it could be a second degree relative also. Those kids have a 50% chance of converting to bipolar 1 or 2 within the next 5 years.